women, a lot of men altogether, a lot of people altogether, men too, but particularly a lot of women think that multivitamins can save them from heart disease. That's not the way. I mean, to save yourself from heart disease, it's basically easy. You eat well and you move. We delay in seeking treatment. We'll go back to the previous slides that we had to skip over about the higher proportion of normal angiogram. Once we decide to start the investigation, we more often than in men anyways, find arteries that look like there's no blockages, but I'll show you what types of blockages women tend to have. And of course, once a woman has had a cardiac event, either has presented with symptoms that are compatible with heart disease, angina, so whether it's chest pain or shortness of breath, but that has gone unstable, that little plaque rupture with the blood clot that I was telling you, so whether the angina became unstable, so we call it UA, unstable angina, or whether it's a heart attack. As you know, the medical term is myocardial infarction, so we call it, it became a name, an MI, and depending on what the ECG shows, it has ST elevation, in which case in Ottawa we have a STEMI program. Somebody calls out 911. The paramedics come, do an ECG at home. If they see the type of changes with ST elevation on the ECG, the paramedics are very, very good at diagnosing that. That means that little artery that's going around, that means that at the end with the clot, it means the artery is blocked completely. It needs to be opened right away. And the paramedics don't bring the patient to the closest hospital. They bring the patient to the Heart Institute, not even to a room, directly to the cath lab. And I see some heads, so you've had, you know, people that have been through this. But after an acute coronary syndrome, this family of plaque rupture induced syndromes are acute coronary syndromes, so ACS. The prognosis in women is also worse. So we're going to go back to the angiography, to all those nice pictures that so that's where we were, and we had talked about the plaque rupture. So if I have a little plaque like this, a little bit of a narrowing, or even more that doesn't reduce the passage of the flow, doesn't reduce the size of the opening by more than 50%, I won't have any symptoms. And oftentimes, non-invasive tests, that's the treadmill, that's the nuclear scans, they don't even show that. A while ago, the Vietnam War, they had, some of these young men, more young men than women at that time, died, and there was a series of studies to see what their hearts looked like. And these young men often had moderate to quite advanced blockages, and the average age was 21. So we know when we said this happens over a decade, it's true. Eventually, it becomes severe. So here, I have no symptoms at all. Here, I might start having chest pains, or maybe not, discomfort, or nothing at all. But some of the tests may be abnormal. Treadmill, for example. So that's a non-invasive test that become abnormal. And then I might start having angina symptoms. We'll talk about it when I'm walking or stressed. So this is an angiogram. And as I said, the artery, so this is the front artery, left anterior descending. And you see the two arrows. What we do is we inject dye in the arteries of the heart, so it shows us the inside. Doesn't show us the thickness of, I don't know where my little artery is there now. Can you lift it up in the air, whoever has it? It's over there. Oh, it's gone the whole way. All right, thank you. So we just see, since we inject dye in the artery, we just see if there's a plaque, we see the inside. So here, this artery looks very smooth, wouldn't you say? It just looks like the normal branch of a tree. And with ultrasound, it's a different type of ultrasound than the obstetrics ultrasound, obviously. It's on a little catheter, on a little tube, and it's a rotating ultrasound. And that's, I'll show you the one at the bottom here. So this is actually the catheter. And it provides a picture of the artery like this. So I can put this catheter in the artery, and then it shows me now the thickness of the artery. So at the top, you can see that the artery, and I have a little caliper so I can measure. And the first arrow is the top, and that's 3 millimeters. It means the room for passage of the blood is 3 millimeters. And further down, it's also 3 millimeters, but that's that picture. Do you see the difference between this one and that one? And just in case you didn't see it, this is all plaque. So this is this. So with an ultrasound, we can see, of course, you can't pass this tube. You can't go like this and all the side branches, that's not reasonable. There would be increased risk. But on occasion, when we're not sure whether there's disease or not, we will use the ultrasound. There's many other indications. But you see the artery, I would describe this as a normal angiogram, but there's plaque. There's, blockages. So to the left, here's so that's an angiogram, a tube, a catheter that we call. A little plastic tube is brought all the way up to the heart from the leg. So you see the tube coming from the leg and coming back down at the very top. And you see this artery is the circumflex artery going to the back of the heart, and the front artery is the same one that we saw before. So this is a normal angiogram, and this is what it looks like when it's not normal. So when we describe blockages, you see over here, I think I assumed that I wouldn't have a pointer. And you can see this should be nice and smooth, and you can see how it looks constricted, and it looks constricted, again, because of plaque that is more severe. Now, what we tend to see more in men is at the top, where there's a localized area. There's a limited area, maybe here and there, but where we can actually call it a narrowing. So we can say there's a 50% there, and a 40% there, and a 30% there. Whereas what we find from the ultrasound in women is sometimes the plaque is all the way through. So when I look, it looks like a smooth artery on the angiogram. Now, this particular type doesn't tend to lead to heart attack as much, but can cause angina and chest pains, or shortness of breath, and all those symptoms. So it's quite important to consider. Now, I'm going to forward back to what we had missed. So, lack of awareness, the red dress campaign. Did you ever see, of course you're aware of the red dress campaign of the American Heart Association. That was instituted in 2002 or about. So all this fuss with the Time magazine, this was, let's put heart disease on the map. Like that was already 15 years after this little study that we did in Ottawa. And in 1997, 30% of women thought that coronary disease was the leading cause of death. And it's all along, it's been the leading cause of death. But we got, even despite the red dress campaign, we can't seem to go much further, 50%. We can't reach those women that don't know that they don't know. So what are the symptoms? Do you know what the symptoms are? You told me a little bit. The main symptom is chest discomfort or pain. We don't tend to call pain. After you've delivered a baby, that's pain. After you've had a kidney stone, that's pain. Angina, we don't call it pain. The men tend to call it pain. We call it discomfort or something. Uneasiness, fullness. We've heard all the terms. So sometimes it's the word we use, even though it hurts. And then when we ask for a scale, how much on a scale of 1 to 10? I don't know. When I delivered, it was maybe a 4. So this is a 1, Like we don't tell them that, we don't think 10. 10 is I would die. But most women with lack of blood flow to the heart, which we call ischemia, most of these women will present with some form of chest pain or discomfort. But sometimes it doesn't come out in the usual first few questions that are asked. We have to kind of go get the information a little more. Women don't tend to volunteer that as much. But other symptoms than chest discomfort or pain occur. certainly it's more common in women than in men, but it's not exclusive to women. So other symptoms, sometimes it's stomach pain or burning sensation, a fullness, discomfort, anything between the ear and the waist that occurs when you're walking, doing something, when you're asking more of this heart that has to speed up a little bit, or upset, and then goes away with rest, is suspicious. So whether it's in the neck, in the jaw, some people go see their dentist because I don't understand that. When I walk the dog, my jaw hurts, and I stop, and it goes away. And dentists are very good. They say, your teeth are fine. You have angina. You need to go see your doctor. The arms, is it more the right arm or the left arm with the heart? Doesn't matter. Doesn't matter. The right arm or the left arm. Shortness of breath, nausea, dizziness, weakness, sweating. Usually not alone. I mean, I just sweat all of a sudden, and I'm 65, and I don't have any other symptoms. It's probably menopause. It's probably not heart disease, sweating alone. But it's often together. Or women will come to the emergency room or will be brought by somebody who cares for them. Say, I just don't feel good. Well, what do you mean? I can't do things anymore. What do you mean? Well, whenever I do something, I feel tired. What do you mean? Well, I feel tired right here. What do you mean? Well, it's just like, this tired feeling that we get. Okay. Any pain? Oh, no, not pain. But do you feel discomfort? Well, yeah, I guess I can call it a discomfort. It goes all the way up to my neck. Oh, yeah. Have you felt it in your arms? Well, it's funny you should say that. My left arm is fine. I checked for that. But I get this heaviness in my elbow, and sometimes all the way to my little finger. That's that. And when does that happen? When I'm walking faster, and then I slow down or I stop, and it goes away. That is the most classic angina. Is it always diagnosed as angina? Of course not. So you need to ask many more questions in women. To suspect ischemia, lack of blood flow in the we call it non-chest pain presentations. Anything else that's angina but doesn't have chest discomfort with it. The most important thing, and I spend a lot of time with the medical students, is, as I said, what happens with activity, effort, or emotional stress. Like tonight, I don't know what time's the game. Does anybody? I see all the men are at home, probably. This. It's on? It's on now. Some people are having angina as we speak. I kid you not. I kid you not. Nobody's plugged in to know the score. All right. The belief systems. What do we believe in? So this was a telephone survey of women. What do you think are the most important heart disease prevention strategies? Okay, this was American. This was in 1997. But still, what came at the top? Getting enough sleep. It's very important, but that's not a risk factor for heart disease. Omega-3.